Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast revealing rogue traders. We know that the world of cosmetic surgery is rife with tricks, misleading images and dodgy practice. So today, Kim and Richard join me to expose the top 5 scams from plastic surgery. They explain the best ways for you to figure out if your surgeon is legit now that the guidelines have changed, how to spot a suspicious before and after picture, and if high sales pressure tactics are still a thing.
I just wanted to go through this, what I thought were the biggest scams and how people can look out for them and how they're impacted by them. The biggest in terms of, I would say it's the most prolific and also the most harmful, is unqualified practitioners. How can patients spot them?
So we are both qualified plastic surgeons, and that gives us a qualification that is FRACS PLAS. So we are fellows of the Royal Australasian College of Surgeons Plastic Surgery, and that is a rigorous training which has very clear cut pathways and then significant lots of exams, a lot of supervision throughout all of the time. So if you're searching and looking up a doctor or a surgeon is what you're actually looking for, you need to look for those specific letters. So FRACS brackets PLAS.
FRACS, that's the gold standard. And sure, plastic surgeons tend to do more of the breast surgery, facial surgery, eyelid surgery, but other FRACS surgeons are also qualified to do things. So that's not the danger. So if they're FRACS and they're an ENT surgeon, they're doing rhinoplasty, that's fine. But where it starts to get tricky, and I'll break this down in a different way. So there can be unqualified surgeons, and that's what Kim's talking about. So if you're not FRACS, you're doing surgery of any type, then that's bad. The harder group is the unqualified qualified surgeons. So they're FRACS, but they don't commonly do cosmetic surgery. So they maybe their main thing is they work at a trauma hospital and they do a lot of road trauma or skin cancer or microsurgery. And then on the side, they dabble a little bit and they do some breast reductions, breast implants, tummy tucks. They are qualified, but that's not their core work. So they're not doing the 10,000 hours that we would do almost yearly in this work, where you get better and better at what you do because that's all you're doing. So they're a lot harder to pick.
We've obviously had a big overhaul in guidelines across the thing. I don't know if you guys have heard of it, but I've been doing quite a lot of work in the background. So have these guidelines changed, impacted the unqualified practitioners?
With these new guidelines, there's another layer that also makes it tricky, and there's 2 tiers to this. So yes, you can look for the qualifications, which is FRACS, but you can also go to the AHPRA website and look up someone's credentials. So we would be listed as specialist plastic surgeons. The medical board has recently, as in July last year, introduced a new category where you can be a specialist plastic surgeon but not be FRACS. And this has already happened, and there are already doctors that if you go to the AHPRA website and you look up what they are listed on the AHPRA website, they're not listed as a general practitioner, they're listed as a specialist plastic surgeons, but they haven't done FRACS. So they haven't done the Australian training. To make matters worse, the medical board are taking over recognition of international medical graduates. So traditionally, and I was involved in this when I was the board chairman of plastic surgery, if someone who has done plastic surgery training or what they see as the equivalent overseas, they used to go through the colleges and we would assess them to see if the training was comparable. That has now from October, that will be taken out of the control of the colleges, and the medical board will use their own guidelines, which are nowhere near as tight as what ours were, to grant specialist recognition to doctors in various fields, not just surgery. In fact, they're starting with general practice, anaesthetics and obstetrics, but it will be rolled out to surgery as well. And that's going to make it really difficult for consumers, patients to work out, because if you go to the AHPRA website, they'll be listed as a specialist, but they may have had nowhere near the level of training that we've gone through and all of our colleagues have gone through.
I can't imagine the audacity to just have never studied surgery and be like, I think
I'll have a
do
crack.
it.
I'll have a crack. I reckon I
Why
can do
not?
it.
I'm going to make my own. And like to start your own practice as well, because I feel like that also gives validity to it, because it's like, you're like, oh, this person has invested like the time and effort and money to making a practice. Surely they're legit.
Yeah.
I know that's not what you're talking about specifically in that one, but I really can't get past the.
No, it's crazy. And,
It's terrifying for all the specialties. Like, imagine someone that's done a very, very low quality of training to be an anaesthetist in that country, and then they come here and they apply to our medical board and say like, oh, I'm an anaesthetist in my country, and they'll be like, oh, okay, tick box, you're free to go. And
some countries have a much, much lower threshold for granting specialist recognition. And as I understand it, the medical board is going to use that country's standard as the level for scrutiny. So let's say in the UK, and everyone would think that the UK training is equivalent, right? But it's not, okay? I've looked at it. It's not. They don't do as many hours. There are a whole lot of rules and regulations that prevent them doing the same number of hours. When they finish their training, they do not have the experience. They do not have the expertise that an Australian trainee would have. More than that, though, their regulations are much lower than ours to have someone come from another country and get granted specialist recognition there. And the problem that we're going to have here is that they've been granted specialist recognition in England, and then our medical board will look at it and say, well, you've got specialist recognition in England, even though they haven't even gone through the English training program, and then we will grant it here. And the whole concept is to try and support regional areas, but they're not letting the regional areas know that they're creating a two-tiered system of medical service. So it's a disaster waiting to happen. Like, we've had it here in Australia before without naming names, but you heard it here first. There's going to be trouble.
they have so much less supervision in a regional centre and less resources and senior people and senior staff, even if they're good doctors that want to do the right thing, it's way more difficult because if they haven't the training here and they don't have the group of mentors and things that they can call on, they don't know the system so well to be like, oh, who can I call at this hospital to ask for some help?
Miracle cures. I think that's a very common one where people just claim that any old thing will work. Do you have any notorious miracle cures you've heard about?
Oh, again, there's so many. I think one of my, not favourites, but something that you hear so much about is non-surgical fat reduction or skin tightening. If there was an amazing machine that did all of those things, we would literally be not offering much surgery to patients because...
We have bought 2 of them, Kim, in our time. We can tell you they don't work. Did you buy 2 or 1? I think we bought 1 and we nearly bought the second.
This was not a me and you we. That was a you and someone else we, the first machine. And the second one, the fat freezing, we nearly bought 2 of those.
Thank God.
We did not. But skin tightening in particular there is just not a thing. It's on a slightly different mode, something that takes away scars as well. I had a massage last week with a new massage therapist, and once he learnt what I did, and I talked about like a lot of my work is removing skin from patients, particularly who've lost weight. He goes, oh, I had this client a few weeks ago, and I think she just had stage 1 of her 2-stage surgery. And I was like, yeah, well, it's often like multiple stages because they have many areas you've got to remove the skin. And he's like, no, she's got all the seams, like she's got all the lines all over her body and she's going back to get all those removed. And I was like, I'm not quite sure either you got the wrong end of the story or I'm not sure if that patient has surely not got a miracle doctor
Sounds
that
like a
is
puppet the way he described it.
removing all of her scars. But we can manage scars and improve scars, but none of the surgery we do is scarless, and nor once a patient's got scars can they be removed.
I'll go with the lunchtime facelift.
Oh, yeah.
So this has taken various different guises, but the most common thing is the thread lift. And over many, many years, many different threads, many different suture materials, many different techniques, many different numbers of threads, none of them work. None of them give a long-lasting result. Might be some initial improvement, but by the end of the week, it's usually stretched back out and you're back where you started.
No downtime. No downtime usually means
no downtime and no result. But there's no downtime.
yeah.
So no. Partially right. 50%.
Next scam, which I think is huge, misleading before and after photos. How can patients spot if it's either been digitally altered or if it's just a trick of lighting?
I think digitally altered is pretty hard to pick up. So let's go back a step and have a look and talk about really what you should be looking for. First of all, you should be looking for consistent lighting. There should be a consistent background. The patient position should be consistent. The photos should be in the same proportion, and the patients should be wearing the same clothing. So same underwear, same bras, or something similar. So they're the things to look for. And then I think from there, that gives you a framework of what you need to avoid. So when you see a photo, whether it's a before and after, and the lighting isn't ideal, there's shadowing, it looks flat, that's an image that's not particularly reliable. And then the after photo doesn't really matter because the before isn't right to start with. The other thing I would say is where you're just showing a limited part of the body. So the classic is a tummy tuck where doctors show like the patient is just lifting their top up a little bit and you can just see from just above the belly button to just above the scar. So you want full length photos, which we always show.
And they usually have full undies on those pictures too. So often you can't even see the scar.
So I think the baseline is really to look at what is a high quality clinical before and after photo, and anything that deviates from that is dodgy. So if you're not putting a lot of effort into taking good quality photos, you maybe want to think about, are they putting in a lot of effort into the actual surgery? So I think you can look at the before image is probably enough to give you the information whether these are legitimate photos. The other thing I'd say is quantity. So anyone can get lucky and have one good result. So if someone's got a website and like there's just one photo, or their social media, they just keep on showing the same image all the time, that'd be another red flag that maybe they don't have a huge body of work behind them. They're not very experienced. They don't do that surgery a lot. If you have a look at our website, if you have a look at our social media, there are the huge number of patients. So I think that would be the other thing. Like you want to see a big volume of work to show that this is reproducible, and it's reproducible across different body shapes, ages.
And particularly as well, if you are having a consultation and if they don't have a lot of images that you've seen before you got to that point, ask to see some in the rooms of patients that are similar skin tone, similar size, age and everything.
Do you think some surgeries lend themselves more to misleading photos than others?
Well, yes, I think, you're not allowed to do it anymore, but I think a lot of the non-surgical procedures are pretty easy because the changes are very subtle. It's very easy to, with some lighting, or put your neck forward a little bit, or you shoot a little bit. I mean, everyone knows from themselves when you're taking selfies but you can change the angle of your face or neck or head or the lighting and get a very completely different perspective of how you look. So I think when you're trying to show subtle changes with filler or some of these thread lifts and things, if someone moves the position of their neck just slightly, the skin tightens and it looks way, way better. Like surgical stuff, particularly the things we're doing.
There's nowhere to hide in those photos, I think. And I would commonly have patients that I've seen and they're happy with their result. I am very happy with their result. And then you get
Photos
their
suck.
images and you look at the photos and it's like, I can always criticise something on things on my own work that are more obvious in a photo than they are in a real living person that's standing or sitting in
it's
front
like
of you.
full light, the most
Yeah.
attractive underwear you've ever seen.
Yeah.
Yeah,
Like,
and there's nowhere to hide, and it's blown up on the screen sometimes too.
next scam is high pressure sales tactics. Can you give some examples of high pressure sales tactics that I think are pretty common in other practices?
Oh, it's not uncommon for a patient to come in and say that I'm the second or third surgeon that they're seeing, and they would say that they felt sometimes comfortable with the surgeon but not with the process before or after that in terms of the pressure. They were like, oh, and they took a deposit like straight away, and I felt like I couldn't really say no. There are regulations now that we are not permitted to take a deposit for 7 days, and there's cooling off periods. But
7 days after a second consult.
Yeah, and I do think they have things like limited time offers and like bundling things together.
There was always when we were training, I don't know if you got exposed to this, or it was just I think it was a Queensland thing probably, but that our older mentors used to tell this story of how they quote for breast implants, and they'd be sitting there and they'd give the price, and if the patient didn't blink, then they'd say per side. I reckon that did happen.
Yeah.
I reckon it
For
happened.
sure. Overseas medical tourism. What makes these trips so risky? And maybe like opens up people to the opportunity. Obviously not every single one is going to be the worst thing ever, but like what can open people up to the opportunity of being ripped off?
with patients that go overseas for either for surgery or for dental work or
Yeah.
for more so dental, when they end up going, oh, like you'd have your boobs done with your teeth, or the other way around even. It's like, oh, they booked in for a breast augmentation, they end up getting liposuction and a mini tummy tuck and their teeth whitened and veneers done, all special deal whilst on holiday.
It just covers all of the scams that we've just previously discussed. So you don't know the qualifications of the surgeon. You meet them on the day. You don't know about the quality of care of the practice because you're meeting them on the day. You don't know the standard of the hospital because you're just going there on the day. You've got no reference point to it. And then there is that, again, that pressure that you're there. Well, maybe you may as well have that all done. Then on top of all of that, and we've said this many, many times, surgery's not a holiday. People think we're going and I'll get a holiday as well. And that's even before there is a problem. If there is a problem, it's a complete catastrophe. There's no other way to describe it. You're then in a different country. You've got no recourse on the original practice, and virtually no one in Australia is going to want to touch you. And often these patients, unfortunately, have gone down this route because it's cheaper, and then they're faced with costs which are multiples of what the surgery would have originally cost in Australia, or you're at the mercy of the public hospital system, who basically couldn't really give a shit. Like that, in terms of cosmetic result, they will just want to get you healed. They don't care. Is it a skin graft? We'll just put a skin graft on it. It's fixed. Get out of here. That's your problem now because you went overseas. So it's just bad at so many levels. You're right. Not every single case is a disaster, which is more testament to the human body and healing powers and how mostly surgery is fairly straightforward. But the question is, do you want to roll the dice and take that risk? It's really all of the scams rolled up into one giant scam, and you're really taking your life into your own hands.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.